Thank you, everybody. I hope that you are there online. I'm going to see how many people is there, but thank you very much for being there today. It's a great day to introduce a good friend, a good colleague. Dr. Rafael Penadés is a psychologist working in Barcelona. He's also a senior lecturer at the Department of Psychology in the University of Barcelona. But it's also a very devoted clinician, and there's a lot of clinical work, but also combining with research, which is one of these strange things that really has happened. And has done an enormous amount of work in different areas, including neuroimaging, including neuropsychology, of course. But today, the main focus of interest was about the cognitive remediation. This technique that I think we should be implementing more often, things that we are not doing enough in our clinic. And actually, all this talk was an excuse to bring him here and learn a bit more how we can do that in our clinic. Dr. has done a lot of research, a lot of awards, including the 2016 Sydney Independent Nurse Award and many others. And I will not spend too much time talking about this. Let me introduce you. Thank you very much, Rafa, and welcome.
Thanks a lot for the kind introduction. And thank you all for being here, for those of you who are online following this session. I'm delighted to be here and thankful to all of you for giving me the opportunity to share some highlights about the cognitive remediation therapy, which is part of my interest in clinical and research fields. Well, I divided my talk into 4 different parts. I don't know if firstly, I will take issue with the role of cognition in psychotic disorders. Then I would like to review the evidence from pharmacological treatments treating specifically cognition. Then to introduce, define the cognitive remediation, and also give you some data about efficacy, neuroimaging, and other evidence. And finally, to get some considerations. Let me begin with an important remark. When treating schizophrenia, clinicians found 2 different scenarios. The first one is the so-called psychotic symptoms or positive symptoms, in which everything is like a kind of emergency. It's like a house catches fire. So it's an emergency. We have to do something immediately because it's dangerous and can't wait for that. Fortunately, we have some interesting rescue, which is antipsychotic treatment, pharmacological treatment. So normally, with antipsychotic treatment, like therapy, etc., we are able to manage with psychotic symptoms. But what will happen next? What's the aftermath? What's the next scenario situation? Normally, there's another different scenario, which is that the house have been absolutely useless. There's everything is ruined, everything is not useful, and we can do anything at all on that scenario. And unfortunately, we are not going to have this rescue from the pharmacological treatment, because in order to cope with these so-called negative symptoms, aberration, flattening affects, blunted affects, poverty of speech, etc., we need to rebuild something. So I will refer later on these 2 different scenarios, but let me go to the point in which I would like to highlight the importance of cognition in psychotic disorders. Why is cognition important in the treatment of psychotic disorders and schizophrenia? We know that cognitive impairment is nearly 90% of patients has clinical meaningful deficits And these deficits are going to last forever. There's no periods of spontaneous remission whatsoever. So we have to take in mind that, but because it's really, really important to know. But the thing to get matters worse, this cognitive impairment is clinically meaningful because there's a strong correlation between cognition and functioning. So cognitive recovery is critical in the treatment of schizophrenia, as if we are interested in improving not only positive symptoms, but also daily functioning and psychosocial functioning, we will need to address specifically cognitive impairments. It has been positive that maybe cognition is the key factor, the cognitive recovery is the key factor that contributes to the functional recovery. And we are talking about an important social dysfunction. Functionality is being so please some. As all of you probably know, 30% of people with schizophrenia are homeless, live in jails, live in hospitals. Only 30% of them are living independently. Also, they have medical problems because of the lack of self-care abilities. About 50% of participants have multiple medical problems rooted in the lack of self-care abilities. Life expectancy is less than 10 years in men with people with schizophrenia. Also, medication management is compromised, is affected by cognitive impairments because some cognitive deficits predict impairments in medication management, failures to refill prescriptions, and patients taking incorrect doses. Social impairments in general are really, really bad in those people because they have reduced social networks, general partners of socially oriented activities are restricted. They have severe difficulties in social skills and social competence, leading to an adverse impact on important aspects such as employment. Even more important than that is that, as I said before, this impairment is persistent, and clinical remission is rare and unstable, with most patients experiencing irregular relapse, even with adherence to oral or long-acting injectable medications. But even though they can improve a lot, symptomatic remissions do not predict functional recovery. So functional deficits are associated with very poor occupational and residential outcomes. So in order to get good functioning, we have to treat specifically cognitive impairment. Some reductions in motivation and reward sensitivity are common in schizophrenia. These do not indicate that patients with schizophrenia make a volitional decision not to seek sustained employment, but they have really important impairments in planning and solve decisions, etc. So that's why, because we are so interested in improving functioning and negative symptoms, basic cognition is a key target in the treatment of schizophrenia, both from psychopharmacological treatment and also with psychological treatment. The evidence about pharmacological treatments. Lots of review of the literature and also meta-analytic studies are telling us that antipsychotic treatment, which are excellent for positive symptoms, has a very limited effect on cognitive dysfunctions. And as I said before, clinical remission does not necessarily result in functional recovery. Even the adjunctive pharmacotherapy for cognitive deficits are not giving us good evidence for that. So we know that very important work are ongoing. Some clinical trials are ongoing with some at-home pharmacological treatments, but up to the moment, nowadays, we don't have any of them available. That's why different agencies, different international guidelines are telling us that to treat cognitive impairment in schizophrenia, we'll have to prioritize to the treatment with the second generation antipsychotics, but they are not going to improve substantially cognition, not function. So the only thing we have is cognitive remediation and physical exercise. Well, let's go to the important point, which is cognitive remediation. What's cognitive remediation? Cognitive remediation is a behavioral change intervention, psychological intervention targeting cognition, attention, memory, executive function, social cognition, even metacognition. Really important is to highlight the use of scientific principles of learning. We know a lot about the learning principles, and we can use it in a very practical way in the clinical setting in order to improve cognition. But it's not the end of the story. We need to improve cognition with the ultimate goal of improving functional outcomes. Because if we are improving cognition, but there's no improvement in daily functioning, we are not going to succeed in this treatment. So normally, some pencil, paper and pencil task, or more importantly, software task in computer programs provide us with different cognitive tasks in which the person can make the training. But the important thing is not having that as a drill practice activity, doing once and once and once again. What is important is to reflect on the learning the person is doing and try to generate new cognitive strategies and cognitive information. I mean, information about how my own cognition is working. So the new generation of cognitive remediation programs pay attention not only on cognitive tasks, but also making the person reflect on the particularly strategy use. And what's the evidence for that? In the first serious meta-analytic study, summarizing different clinical trials in real settings, systematic group from the States found that cognitive remediation therapy is effective in improving cognition and also functioning. Although the side effects are not really big, but they actually have statistically meaningful things. But also, it is important to say that when we talk about functioning, or improvement in functioning, we are referring to obtaining, working in competitive jobs, saying that the quality of and satisfaction with interpersonal relationships and the ability to solve interpersonal problems, which is really important thing. We don't have alternatives in order to improve that important aspects of schizophrenia. In the second meta-analytic study performed by T. Weiss here in the UK, They found similar results about cognition with more studies and functionings, and also some highlights came from that study. That major element, which is significant for us in terms of the type of rehabilitation program, the duration of the program, the use of computer program. So it's not a matter of trying to choose the right cognitive program. All of them will be useful. Will be useful if the therapist use the program in order to perform the so-called strategic approach. So again, the important thing is not to do cognitive exercise every day, but to take advantage of this practice in order to improve your cognitive abilities and strategies, reflecting on the time you need to codify an information just in order to recall it afterwards, or how to planning some tasks and sequencing the different steps, etc. So results obviously are more significant when they are part of a more comprehensive rehabilitation program. So if we train with cognitive remediation a person and then don't pay attention to other aspects such as social skills training or some social resources, maybe this functional improvement is not going to be complete. Then the same group who defined the elements of the cognitive remediation try to say which are the core elements of cognitive remediation. It was defined that it is absolutely important to have the facilitation of the therapist. So there's no rehabilitation if there's no therapist. The practice of cognitive exercises to facilitate cognitive and problem-solving strategies again, and to promote the transfer of cognitive skills to real life functioning. That was a theoretical definition, but in the last meta-analytic study by Antonio Vita in Italy and others, they tried to test the evidence about cognitive remediation on cognition, symptoms, and functioning, but they tested specifically the importance or the evidence for these 4 active ingredients. They found similar results of other meta-analytic studies. So definitely, these 4 meta-analytic studies in 10 years saying that cognitive remediation is effective, is an evidence-based intervention. It's useful to improve cognition, but if a strategical learning approach is used, it's also used to improve daily functioning. And all the 4 core elements are absolutely important. We need an active and trained therapist, because otherwise results are not going to be so good. And a structured development of cognitive strategies, which is the more characteristic aspect of cognitive remediation, and also the integration with rehabilitation process. And all of them are crucial ingredients of efficacy. So that's why nowadays the majority of international guidelines are recommending cognitive remediation therapy from the American Psychiatry Association, the POR guidelines, the Australian, New Zealand, Canadian, German, Spanish, etc. So this is the right moment to change the path. So we know that prevention is relevant in the treatment of schizophrenia. We know that pharmacological treatment are excellent tool for positive symptoms, but not so good for cognitive and negative symptoms. And we know that cognitive remediation is an evidence-based approach. Another different thing is that it has been suggested that there's a progressive brain changes in schizophrenia in terms of progressive grid matter volume decreasements, lateral ventricular volume increasements, and it has been suggested that it can be or it may be associated with antipsychotic treatment. It's still an open question, but at least we have some evidence from that. So we know that the rescue of pharmacological treatment is so good for one thing, but maybe possibly having some pervasive effects on cognition. So what about cognitive remediation? Cognitive remediation can be this rebuilding aspect, trying to generate new things in the brain. It's not only going to the receptors in the limbic area and trying to doing things with dopamine, etc. What is cognitive remediation able to do in terms of brain functioning and the progressive decreasement of brain and white matters? We know we have some data about brain morphology and volume, telling us that it could be having some protective effects in gray matter of the frontal and temporal lobes that, as it has been suggested by Egg in this stage. They tried to make a follow-up for 2 years, two different groups, one performing cognitive remediation and not the other. The treatment as usual group have the normal changes in terms of progressing of decreasement of the matter, and the group with cognitive remediation stops this increment. It has been stated that some increase of volume in the hippocampal region has been described. Also in the white matter, some augmentation in the fractional isotropy indexes of white matter figures at the corpus callosum, connecting the two lobes, just in the region connecting the two dorsolateral prefrontal cortices, favoring the model according to the model of interhemispheric balance in cognitive recovery, and also some increase in white matter fever in posterior lobe or left cerebellum. So at least some positive effects can be expected from cognitive remediation. In terms of brain activation, we know that there's some hypoactivation, especially in frontal areas. And some meta-analytic studies show us that cognitive remediation is able to increase response, mainly prefrontal lobes, parietal lobes, and some areas of the temporal regions. So in a way, cognitive remediation could be also useful in improving brain activation patterns. Regarding networks, it has been described some increments in activation in the central executive network. We performed the first clinical trial demonstrating that, and we have these results have been replicated in the States and this 3 times, suggesting that the central executive network is improving their activation after cognitive remediation. But sometimes it's not only a matter of improving activation. Sometimes some networks are overactive, such as the default mode network, which is normally overactive in schizophrenia. After the cognitive remediation, some regulation can be expected. And most important, the synchronization between the default networks and the other networks, which you know that they are anticorrelated and are also important and some improvement can be expected. In terms of connectivity, some general improvements in functional connectivity have been found, increasing thalamus connectivity and also some sensorial motor networks. And if that happens, we would like to find some biomarkers for mediating factor of these brain changes. We focus on BDNF, which is, as you know, a protein acting as a neuroprotective factor, neurotropic factor, sorry. And it also is really related with the dopaminergic system, glutamatergic nerve system, serotonergic system, and so on. So the primary trial performed by Sofia Villarreal in California tried to test the serum BDNF levels with people with schizophrenia, performing cognitive remediation and doing the same amount of hours in front of a computer with computer games. And they found an important and statistically difference between the two groups in terms of improving the levels of BDNF serum, the BDNF serum levels in people doing the cognitive remediation. This finding has been at least one time replicated, and we tried to replicate that, and at first stage we failed because we couldn't replicate with the whole sample. Then we tried to make a secondary analysis, and we divided the sample according to the different polymorphisms of the BDNF gene. And what we found is those of them who were MET carriers were not able to improve their BDNF cell levels, but the bulbar environment, the bulbar, polymorphism were able to show the same amount of change in BDNF cell levels. But we try to go beyond that, trying to focus on epigenetics, trying to test anything related with the promoter ions in the genes which are responsible of the BDNF gene production. And what we found is that people with following cognitive remediation therapy make some different mutilation patterns on the promoter ions of the BDNF, and no changes in those patients following the treatment as usual, which is a really interesting thing because we are now getting a broader framework of what is going on with BDNF in the brain. And more interestingly, these BDNF methylation changes are statistically related with the changes we shown after the cognitive remediation therapy. So the evidence is for cognitive remediation. Well, the first one is that it is an effective intervention that improves cognitive performance and associated social dysfunction. It is for the majority of the international guidelines the only treatment in evidence-based treatment. So it is difficult to understand why it's not more broadly used in clinicians in clinicals of psychosis, because it's not so expensive and it's not difficult to implement. It's only a matter of training and have some human resources, of course, because as I said before, therapists are absolutely important. Then Also, beyond the improvement in cognition and functioning, it has been shown that the cognitive remediation is capable of inducing changes in proton brain activation pattern, which is also really interesting feature. And it is to increase the efficiency of effective neural networks. And this improvement probably could be mediated by the release of neurotrophic factors. So, just to conclude, the cognitive remediation is an evidence-based. It's considered the first line of treatment for the cognitive impairment in schizophrenia. Treating cognitive impairment is crucial in order to improve daily functioning and psychosocial functioning. And it is probably the best option to ameliorate progressive brain changes and to prevent functional impairment. I know this is tentative and this is the first stage of this research, but it seems like we are going to get more data in the next time. And finally, I think cognitive remediation therapy should be implemented more widely in standard treatment of psychotic disorders. Well, that's all. I would really like it if you have any questions, comments, or...
Yeah. Thank you very much. Sharing and see. So thank you very much.